Your retirement healthcare costs are going to be one of the biggest expenses you have in retirement, right there alongside your lifetime income tax bill. But when it comes to retirement healthcare, what a lot of people don't understand is that there are specific moves you can make to minimize these costs over your lifetime. So I want to talk about that today in today's video. I want to share some insights on things to do in your last year of retirement and in the first couple of years of retirement and ongoing in order to minimize these costs for you and your spouse. I also want to talk about costly mistakes that you want to avoid making. And stick with me to the end because I'm going to be sharing places and ways that you can save money in your retirement healthcare costs. So no matter what stage you're at right now, there are ways that you can save money with your retirement healthcare. Let's start by talking about that last year of retirement. In that last year of retirement, of course, you're hopefully very excited to be retiring soon, but there are things that you should do to prepare for your retirement healthcare transition. And one is make the most use of that healthcare plan that you currently have. When you transition to retirement, you're going to have different coverage. You may or may not have all the same doctors on the plan that you're going to be on. You may or may not have all the same benefits. So use all the benefits in your company plan in that last year of retirement. Get your checkups done. If you have glasses, get a new prescription. Go to the dentist. Do all of the things that you can do before you retire. Most people will have that annual checkup and get a colonoscopy and things like that, so that that's out of the way. But sometimes people even do more than that. I've had some clients that have gotten hearing aids because they're not going to have the same coverage once they're retired, or have had a back surgery or a knee surgery or some other procedure because it was a low deductible and they knew the coverage and their doctors were on the plan. And so you want to think through that. What should you do to make the most use of that healthcare plan that you're on? The other thing you want to do is look at your savings for healthcare. You might have a health savings account, or you might have a flex savings account. If you have a flex savings account, then be sure to go ahead and use it up because it does not go with you. If you have a health savings account, that money will go with you. And that is an excellent account to take into retirement because the money you put in went in with no taxes on it. It grows with no tax due. And then when you take it out for healthcare costs, there's no tax due on that. And it can help cover even some of your premiums. It can cover Medicare premiums and long-term care insurance premiums. It does not cover Medigap. That's that supplemental policy you get for Medicare, or the ACA insurance that you would get at healthcare.gov if you're below age 65. It doesn't cover those, but it covers a lot of the premiums as well as deductibles and out-of-pocket costs. So that's an excellent plan to have or account to have once you go into retirement. So you want to max it out. If you're under the age of 65, get as much in before you leave work. If you're over 65, then we're going to be talking about what you need to do with that. Now, in the first year of retirement, you want to consider, where is your insurance coming from? Are you going to be getting insurance through Medicare because you're 65 or older? Or are you going to have to look for other coverage because you're under 65? And if you're looking at other coverage, you'll be comparing COBRA versus insurance plan through healthcare.gov, the ACA plans. That coverage can be very expensive. It can be $15,000 to $20,000 for a couple for a year. And so that sometimes causes some people to say, I'm just going to wait to retire. I know I could retire, but I'm not willing to pay this much out of pocket for health insurance costs. One thing that you can consider is whether you're able to get any premium credit subsidies for the ACA coverage. That is based on modified adjusted gross income. So it's going to depend on what your retirement income looks like. If you have retirement income that's fully taxable and that's going to come in when you retire, you're going to have a pension and it's going to be similar to your prior income, and that's going to push you into a bracket above the threshold, then you wouldn't be able to get a subsidy and you wouldn't have a lot of control over it. But a lot of my clients do have control over where they're pulling the money from. So for clients that don't have deferred comp coming in, or they don't have some buyout of a business or a business building and those payments coming in, where they're able to just look at their accounts and decide, we do the analysis and decide where are we taking the income from each year. I've got one couple right now that recently retired, and if we were to take income from their IRAs that were rolled over from their 401ks, that would be fully taxable, and to take the amount of income they need to fund their lifestyle and their travel and all the things that they're doing, that would put them over the threshold. But they also saved proactively ahead of time in Roth IRAs. And so we're able to very strategically take a smaller amount from those IRAs just to fill up the lower tax bracket, and then use the Roth accounts to manage their modified adjusted gross income. With some clients, we're looking at managing the long-term capital gains and how that falls. Whatever the case may be, you have the ability to control how much income you have if it's coming from your own accounts, and you have different tax buckets that give you the ability to have some options as to where you're taking money from. And if you can control that income and you can keep your modified adjusted gross income below that threshold, then you're going to get some premium credit, and it's going to bring your health insurance costs down to a more manageable rate. So with this couple where we're using the Roth IRA, it's bringing that health insurance cost down to similar to what they were used to paying for when he was running his own business. And so, that is comfortable to them. And that is something that you'll need to look at and analyze for your situation for each year that you're going to be retired. Now, if you're age 65 or older when you retire, then you want to be sure that you sign up for Medicare premium unless you have the option to be on a spouse's plan and it is definitely creditable coverage and you get that in writing. But you want to sign up when you're supposed to sign up so that you don't have the lifetime penalty associated with waiting. And that lifetime penalty is hefty. 10% a year for each 12 months that you wait. You don't want that lifetime penalty because it doesn't go away. The other thing that you want to look at if you're over 65 is your health savings account. You have to stop contributing to the health savings account 6 months before you turn on Social Security or age 65. If you're starting Social Security right at age 65, then you don't have to stop contributing at 64 and a half. You can contribute all the way up to age 65 because Medicare will not start before age 65. But if you're older than age 65 and you turn on Medicare, they are going to backdate for 6 months. And that ensures that there's no gap in the health insurance coverage from the point in time that you retired to you actually got on Medicare, because there can be some little timing issues with that. So they will backdate. And if you've got health insurance contributions going in during the time that you're on Medicare, those are considered excess contributions because Medicare does not qualify for health insurance for the HSA contributions. It is not the type of health insurance that would allow you to make a contribution to your HSA. Now, I had a client that retired at 67, and they put money into the health savings account every single month all the way up to the end, and they maxed it out before they retired, thinking, okay, we get the annual max in for the year before we retire, that way we can max it out in this last year. But what they didn't understand is that it's actually based on each month, so it's a prorated amount. And once we ran the numbers and looked at their situation, then I showed them how they had to take money back out, how much they needed to take out, what was the excess that had been contributed to the health savings account what sort of penalties were there in getting that out of that account for that year. So it was doable. It wasn't a devastating mistake, but it was a surprise. And it was a little bit of a cost that they didn't expect that they would have. And it sort of took the wind out of we thought we were doing this really good thing to get it all maxed out in the early part of the year, when they didn't realize that they couldn't do it in that manner. So you want to be sure that you're timing those health savings account contributions appropriately for the amount of time that you'll be on the type of plan that qualifies, and make sure that you're not putting any money in for any month that you're going to be covered by Medicare. Now, beyond that, on an ongoing basis, you want to always be looking at your modified adjusted gross income to compare it to the thresholds to say, where is this going to put me? Am I going to have an IRMAA surcharge based on the income? Or am I going to be below that lowest threshold? When you retire, in that first year of retirement, often your income goes down. And yet, if you're starting your Medicare at that point in time, that Medicare premium is based on your income from 2 years prior. That's literally because that's the most recent tax return that the Social Security Administration has that they can review in order to say, here's your income, here's your threshold, here's which bracket you would be in. And so a lot of times people are surprised at how big of an IRMAA surcharge they're hit with when they get a letter from Social Security right after they retire. Now, on the positive, you can't appeal that. There is the ability to file Form SSA 44, which lets Social Security Administration know that your income is lower because of a life change. And retiring is one of those life changes. And so you'll want to be very familiar with how that form works, what you need to put on the form, and then in the year that you retire, if 2 years prior your income was a lot higher, then you'll want to submit that form in order to bring your IRMAA costs down in that first year of retirement. And I've helped a lot of clients fill this out, get that submitted, and we brought them from the third or fourth or fifth bracket of IRMAA surcharges all the way down to either no IRMAA surcharge or maybe just the top bracket, depending on what other planning we're doing. Which brings me to my next point. In managing your modified adjusted gross income, you're going to want to think about Roth conversions. I do a lot of Roth conversion planning with my clients. How much should you budget for Roth conversions this year and each year in order to maximize your benefit from Roth conversions, minimize your lifetime taxes, but also make sure that we're not pushing other income up into a higher tax bracket or pushing your IRMAA costs up higher than you want. A lot of times it can make sense to pay a small IRMAA cost, a small surcharge, because we know we're bringing that future surcharge down from a very high level to a more manageable level when those future required minimum distributions kick in. But sometimes it makes sense to have no IRMAA surcharge. And so you want to look at what is that amount, because you're looking at the timeline, what is going to happen in the first few years of retirement, what's going to happen later on. And so what makes sense when it comes to doing the right amount of Roth conversion to keep your lifetime tax bill at the best level all the way each year, from year to year. Some years you'll have a bigger Roth conversion. Other years you'll have a smaller Roth conversion. Before 63, if you have that gap period where income is very low, and if you're not needing to keep your modified adjusted gross income at a very low amount because of the ACA premium credits, but if you've got some flexibility because you have maybe COBRA insurance or other coverage, if you can make big Roth conversions in those years, that's not going to impact your IRMAA, and it's going to give you much bigger Roth amounts contributed over. And I do have some clients that retired in their late 50s, and we are making very big Roth conversions as we go along. to bring those IRA balances down and those future required minimum distributions down. And they are not trying to hit the ACA premium threshold because their other income already puts them over that. So we're not needing to think about that or worry about that. We're just monitoring what is their overall tax bracket and how does that compare now to what they're going to pay later. And so as you go along, you want to look at what should you be doing year to year with Roth conversions? What should you be doing year to year to keep your modified adjusted gross income at a lower amount? I talked about this SSA 44 and the fact that you can use that if you retire and you have this life-changing event because you've retired. There are other life-changing events. Could be the death of a spouse. Could be a divorce. It could be you've lost your pension income. If there are changes that qualify as a life-changing event, then you can use that as an opportunity to submit that SSA 44. In a situation where you know you're going to have a life-changing event, you know that ahead of time. Well, in the year before that life-changing event, you could consider making use of the fact that that income is not going to impact your Medicare IRMAA costs. And you could maybe make a really big Roth conversion in that year or do other planning in that year and then know that the following year you're going to use that life-changing event and you're going to say, Social Security, I've had this life-changing event and my income for this year is going to be X. And then they will adjust your Medicare surcharge based on that information that you give them for that year. And typically you can do this for 2 years after each life-changing event. With that, I want you to know, if you're a client, these are the things that I work into the plan, and I am working with you. I am monitoring these costs for you, the levels, the thresholds, all of the planning, all of the things that need to be done. Now, if you're watching this and you're wondering how I help women and couples just like you, and what would that look like, you can head over to my website at www.bestpathadvisors.com. And I have a lot of good information on the website that lets you know how I work with people. And if it seems like it's a fit and you're interested in talking, then you can schedule a conversation there and we can talk about your situation, what you're facing, and how I might be able to help you.